Hello, everyone, and welcome to ThinkYoung's first YC4PV webinar of the year. So today we're doing Let's Talk HPV, eliminating the virus for future generations. So HPV is one of the most common viruses, and at one point in their lives, men and women will be affected by this. But the lack of education and the vaccine coverage rate means that we are hindering our chances of preventing HPV from being eliminated for future generations. So with the European Union's ambitious Beating Cancer Plan, which aims to eliminate cancers caused by HPV through vaccinating at least 90% of the EU's target population, how are we going to meet these targets if there are huge disparities amongst EU countries? So with the ongoing COVID-19 vaccination campaign, what can we learn from this, and how can we continue to accelerate the campaign for HPV amongst young girls and boys in Europe? So last week was European Immunization Week, and we want to continue the conversation around vaccination and prevention. So my name is Ulfet Enver, and I'll be moderating the conversation today. And I have with me three amazing speakers that will talk to us today. So please do share on social media with us any of your questions or your comments. And I'd love to introduce our three speakers. So today we have with us Carlota Montes, who is our YC4PV member. And then we have with us Juan Lee, who is Project Assistant at ThinkYoung. And last but definitely not least, Andreas, Rauscher, who is Regional Director of Medical Affairs Vaccinations at MSD. So thank you very much for joining us. And please do send in your questions and your answers for our speakers. So I want to start with you, Carlota. So I became aware of HPV a few years ago. In my adolescence, I had absolutely no idea what HPV was. So many adolescents and many adults like myself have no idea what HPV is, and despite that, nearly all men and women will actually catch this virus at some point in their lives. We must accelerate the awareness around the vaccination. Hello, Tomislav. Okay, I want to pose this question to you, Carlota. As a young healthcare professional, why do you think so many people are unaware of HPV?
Sure. Thank you, Ulfet, and thank you, the team, for giving me the opportunity to be here today. As you have just mentioned, Ulfet, there is still, unfortunately, a significant HPV knowledge deficit worldwide, despite the fact that safe and efficacious vaccines are available. And I would say that there are disparities on the level of knowledge with people that are completely unaware of HPV, and people that, although they are aware of HPV, they miss this kind of more detailed, deeper understanding of the virus itself and all the health-related conditions, let's say. So, for instance, they might be unaware that beyond the cervical cancer, HPV causes oral or anal cancer, or unaware that condoms do not fully protect against HPV, or even unaware of the prevalence and therefore the need for vaccination. In my opinion, many factors might be contributing to this gap of knowledge. One point is former advocacy campaigns that for me were strongly focusing on prevention of cervical cancer versus the broad prevention of HPV, and those campaigns were somehow missing this neutral tone that would include boys and girls, right? Another point would be the lack of recommendation from healthcare providers. And my personal experience is that neither my family doctor nor my first gyneco share with me anything on the topic. And lucky me, I changed from gyneco, but I'm not sure if timely enough. And then I would like to end up by mentioning the educational piece, which is also missing a bit. For instance, maybe HPV education, it's not completely integrated in, let's say, the existing school-based health curriculum, no? Me, certainly, when I was at school, I don't recall having any specific point subject regarding HPV or kind of sexual transmitted diseases. And even when I was studying during my pharmacy career, indeed, we had this technical knowledge, but not much on perhaps the way on how to communicate it to other people and raise awareness on the thing that we were indeed, learning on. So those are a bit most my thoughts about that. So back to you, Ulfet.
Thank you, Carlota. Thank you for your thoughts there, and welcome, Tomislav. So we have Tomislav Sokol, who is our European member of the European Parliament. So welcome.
Thank you, and thank you for inviting me.
Thank you. I actually want to pose the next question to you. I want to hear your thoughts as well. Why do you think so many adolescents and young adults are unaware of HPV, despite how common it is?
Yes, I think that's the million-dollar question. I think there are big differences first across the European member states. I can speak from the experience of my country that speaking about sexually transmitted diseases and sexual life in general is still a bit of a taboo, especially in the younger population, especially in primary school and high school. So this is definitely a big problem. So they kind of they get all the technical data, as was already mentioned. A lot of it is available on the internet, but to really discuss it in depth and to discuss all the possibilities and all the dangers that exist, that's something that is considered pretty far from everyday life, let's say. So I think that's definitely one problem. So it's cultural. The second problem is that there are big differences in terms of the public perception of the HPV and how important it is. And I have to say that unfortunately politicians usually who can do something in terms of investing into screening programs, into raising awareness campaigns, etc., usually are focused on things which are much more short-term, where they have short-term results, let's say. And here, if we want to make things better in terms of decreasing incidence of the cervical cancer, again, which is the strongest potential consequences of HPV, these positive effects will be visible in 5 or 10 years probably, or something like that. So this is definitely something that because of this reason is not usually perceived as a political priority, I have to say, unfortunately. So raising awareness and raising the political clout, let's say, of this problem is something which is very, very important. And obviously everything is connected to this, because it's since our public health system, our health systems are mostly public in terms of insurance, in terms of provision, in terms of especially early diagnosis, prevention, screening programs. So all of this in Europe is mostly public. So it depends on public funding. So what we need to do is to raise the public awareness in general of this, to also put pressure on politicians like myself, I have to say, to really engage more in this topic and to put more resources, both financial, both personal, into awareness campaigns to actually show people why this is important. And the last thing I wanted to say, what I think is also important, is to try to speak with young people, kind of with their own language. Because when somebody comes to speak ex cathedra, some elderly person about public health hazards, risks, etc., this is also something which does not correspond to their way of thinking, their everyday life. So I think it's one good tactic, can be also to try to find young ambassadors, maybe people who are popular with younger generation, for them to speak to them in their own language, so that they can understand what potential dangers there are. So I think definitely, there is a lot of room for improvement. I think that we on the political level have to do our part, and I think these kinds of campaigns where we raise overall awareness of this and put pressure on the policymakers are very important.
Thank you so much for sharing your view. And I want to pass over the next question to Juan. Juan, education around HPV is in dire need of improvement to ensure that we can prevent the spread of the virus. So how can we speak to young people directly and best communicate with them around the importance of preventing HPV? So can you tell us more about the work you are doing to advocate for HPV, especially at the Italian level?
Yeah, sure. Thank you for your question. So as probably all of us know, both the WHO Global Strategy and the European PD Cancer Plan call for an increase in awareness on this important topic that, as we have been mentioned, already, there's need to increase knowledge and health literacy in this. And looking closely at the Italian context, especially the lack of information is still one of the main obstacles for not allowing to reaching the national vaccination target of having 95% of teenagers vaccinated by 2020, and also cause a low number of screenings. For example, only 50% of women who were invited to get their screening actually did so. And this problem is even made more complex and hard to solve by regional differences that are very much present in Italy. And this difference is in systems, in data, and also information. And that is why, together with other organizations in Italy, we launched this manifesto called Manifesto for the Elimination of HPV-related cancers a couple of months ago. And here we stressed the importance of activating an awareness campaign. And this can be, we suggested four ways to do so. First of all, dissemination of accurate information, consistent accurate information, especially with a strong scientific base, especially on social media. And many researchers found that especially young people and young parents go on social media to seek for information on vaccination, and their choices, it's more predicted by their network than their own characteristic. So these results strongly suggest that social networks, and particularly the network of the parents, are important factors for them when it comes to their decision-making process for their children. And thus we need a reliable information on social medias, first of all. And second, we advocated for more action into schools, especially in primary and secondary education as well, because also students spend the majority of their time in school, and there are currently now foundations and NGOs doing lessons and advocating and spreading information on this, but maybe a regional level program or a national program might be beneficial for more children and more students that are actually in the age of getting the vaccination. And then also including GPs and healthcare professionals in this campaign, awareness campaign, is also very important, especially in Italy. As I said, there are many differences between regions. So there are different ages that you can get the vaccination, and also in 6 regions, for example, the vaccinations for HPV vaccination for boys is free, but in others is not. And also this is these differences cannot be easy to grasp for the majority of the people. And also lastly, creating a network of ambassadors of young people sharing their experiences might be also, as Mr. Sokol just said, a way to engage people with their own words, and having a peer-to-peer information might lead to a naturally to sharing best practices also in this way.
No, thank you. I think young people are definitely the key in vaccination prevention as well. So Andreas, I want to ask you a question. Many individuals who contract HPV are ashamed about their diagnosis, or feel dirty, or even at some points embarrassed. So because of this, many people choose to not even disclose their HPV status. So how can we break the stigma around HPV, especially among adults, and how can organizations such as MSD contribute to this?
Yeah, thank you so much, Ulfet, for the interesting question, and also for inviting me to this interesting and important discussion about HPV and eliminating HPV-related cancers. Regarding your question, yes, HPV-related diagnosis is often associated with a feeling of shame and embarrassment, and mainly since HPV is a sexually transmitted disease, and is frequently associated with negative stereotypes like promiscuity, for example. And for that reason, HPV is usually not part of casual conversations, and that leads to a very low level of awareness and knowledge around HPV, specifically in the general population. And many people no matter if they're young or older, don't know how common HPV actually is. And as you mentioned before, most people will come in contact with the virus at some point in their lives. Many infections remain unnoticed since they clear within a couple of months or up to 2 years, but some infections persist and they can cause anogenital warts, they can cause even cancers in some cases. And in addition, HPV is still widely perceived as a virus or disease that mainly affects women, and the vaccines that prevent disease or infections are widely perceived as women's or cervical cancer vaccines. But there are several other cancers, other types of cancers that can be caused by HPV, like anal, penile, vaginal, or vulvar cancers, for example. So to also touch a little bit Carlota's point that you mentioned before, girls and boys, women and men are affected by HPV and can benefit from vaccination. And in a so-called gender-neutral or universal vaccination approach, an additional layer of indirect or herd effect is added to the individual protection against HPV. So in addition to that, even though we know that vaccination is most effective at a younger age, before actually coming in contact with HPV, adults also benefit significantly from HPV vaccination, since it provides protection against several different types of HPV, of the virus. And this benefit is also widely underestimated. So to go back to your original question, how to break the stigma, I believe we have to focus strongly on education regarding HPV and related diseases, raising the awareness, and ensuring that people know that HPV is a very common virus and infection, and definitely nothing to be ashamed of. We also should be working towards a mindset change regarding the perception of HPV, so current and also future generations will become more aware of the value and importance of the broadest possible protection against HPV. And a high level of awareness and knowledge about the high prevalence of HPV will then also reduce the likelihood of feeling stigmatized, but also will make it less likely to stigmatize others.
Thank you very much. Carlota, I want to ask you a question as well. So like COVID-19, some have the symptoms of HPV and some are asymptomatic. We are all at risk of passing along HPV without even being aware. We all take the necessary precautions to protect ourselves from others against COVID-19 because we are educated on just how to. We are focused on getting vaccinated at the moment, and we are taking the necessary precautions to protect ourselves and our loved ones. But why shouldn't we do the same for HPV? So, Carlota, what can we learn from the COVID-19 mass vaccination campaign, and how can we improve access to HPV vaccination to young people? Carlota?
Yeah, sure. Thanks, Ulfet. It's a very good point, and definitely how it should be. We should build on the lessons learned from COVID-19 pandemic in that sense. And in fact, the pressure from the COVID-19 pandemic highlights the sustainability challenge on the healthcare systems. And investing perhaps in disease, perhaps in disease surveillance and prevention offers this path for sustainability. And more specifically, lifelong immunization, it's an essential ingredient for strong and resilient healthcare systems. And yet, there's not the priority, neither from budget nor platform perspective. So to support a successful implementation of this lifelong immunization, and therefore to improve the access to HPV vaccination, I think that governments should expand the vaccine delivery channels maybe to pharmacy-based or school-based or employer-based, etc. So I mean that at the end, COVID-19 has clearly demonstrated that developing additional challenge for delivery of immunization beyond the traditional childhood channels provide somehow the government with an ideal platform on which to build the delivery for vaccination. And this we can see that with the vaccination of COVID that has been accelerated in countries that have already adult vaccination strongly integrated in the national plans, like for example, countries with strong flu vaccination systems like UK or US. So overall, I think that there's still a lot to do in that sense to promote this lifelong immunization and the multiplication of the delivery channels as a solution that could improve the access to HPV vaccination immunization in general.
Thank you very much. So, Juan, COVID-19 has halted routine HPV vaccination, and to successfully recover from this, catch-up programs need to be implemented. So many healthcare professionals have even suggested that pharmacists can play a large role in the recovery of, by pharmacies becoming complementary and accessible places for the HPV vaccination. But should this idea be open to implementation in all the countries, following the lessons learned from the COVID-19 mass vaccination campaign, and why? So could this benefit the population as a whole? So what are your thoughts on this?
Yeah, thank you, Ulfet. This is actually an interesting question. Pharmacies are one of the services that are present both in urban and remote areas, and they have convenient opening hours for everyone, and they facilitate quick walk-in consultations, which is not granted when you know sometimes when you have to make an appointment to your GP or to your hospital. And also it's important to remember that pharmacies were one of the few services that were accessible during also COVID lockdowns. And now currently in Europe, as far as I know, vaccination are administered in pharmacy in 13 countries, such as Portugal, France, and a few regions in Italy, and outcomes has been positive in terms of coverage rate, also citizen satisfaction, and more countries are also developing COVID vaccination programs, including pharmacies, in order to reach their target vaccination numbers per day. And in Italy, for example, more and more regions are allowing pharmacies to take part in their vaccination programs. Of course, it's not mandatory for them, but it was surprising to see how many pharmacies actually joined this initiative and expressed their interest in doing this. And more regions are implementing this program, and already few pharmacies are going through the training programs in order to be ready to have this role as well. And so I believe if we can do this for the COVID vaccine, we can definitely be able to do this for the HPV vaccination. And for example, in our manifesto, we mentioned that in order to reach the whole population, we should also organize the vaccination system in order to make the access easier in a context of territorial proximity, and also to reach people who don't live in urban areas or don't have access to hospitals or the vaccination centers. And this means also using institutions or centers that are not the traditional ones, let's say. And also an active vaccination campaign should be put in place, also with the use of digital tools, in order to also be able to track all these vaccinations and monitoring, which is also one of the struggles that we have in Italy, again with the regional disparities and the regional a difficult regional coordination in this case.
Wonderful to hear your ideas. Thank you, Joanne. So, Tomislav, I actually want to ask you two different questions. But first, I want to ask, so similarly to opening up pharmacies to increase the access to the HPV vaccination, what kind of other centres or places could be open for this purpose instead?
Yes, this is a very interesting question, and I heard interesting arguments about this, and I agree that pharmacies are one very good possibility because they are so widespread. So in all I think all countries in the European Union, there are rules how far pharmacies have to be from within a certain geographic area, etc. So I think this is one possibility. Also, in some countries, there is also a network of primary healthcare centers. So not just private GPs who are contracted, but real primary healthcare centers with all the infrastructure, which I think can also be one possibility because it's much easier to anonymize those who get the vaccine. Because I think also schools are one of the possibility, but I think that one thing that is important if you want to raise the numbers of young people who are vaccinated is that this can be as anonymized as possible, so that their personal data is only available to a handful of people within the system, but that it is not a wide known fact also in school with their friends, etc., etc. So I think this is very important. So to devise a system which is not bureaucratic, which contains as few requirements and documents that you have to fill in as possible, and then to have it as widespread as possible. So primary healthcare centers, pharmacies, within the local communities, especially rural communities, that is a problem. So that is much more complicated, and I think also taboo in these areas is much stronger than in big cities. So I think that some ingenuity is necessary to do it there, but maybe it's important then to talk with most important people in these local communities and see how they can organize this in a way that people do not feel stigmatized. But I think what is also important, apart from reducing the bureaucracy, making it geographically easy to access and also to be as anonymous as possible, is also to provide social security coverage, health insurance coverage, so that it is also free of charge. Because if you have to pay, then obviously for young people who are in school, that's a big problem, that they will have to talk to their parents, which maybe they are uncomfortable of doing, to pay for them. So I think to have this kind of a framework of coverage, of reimbursement, of providing it actually free of charge to the population is very important. And of course, in that case, there can be a problem in federal countries where different regions have different rules on what is covered by health insurance and what is not covered. But this is unfortunately something which is also dependent on the national context. So European Union cannot not do much because health insurance coverage and reimbursement is part of the national prerogative, of the national competence. But I think what we can do at the European level is also to produce some kind of guidelines and recommendations and try to engage local institutions for them to really see this as a priority. But of course, obviously, if you want this to be free of charge, then also we have to put this much higher on the political agenda as well.
Thank you. Second of all, I want to ask you, so you've worked in the special committee for the European Union's Beating Cancer Plan, and the plan's objective is to vaccinate at least 90% of the EU target population of girls and significantly increase the vaccinations of boys by 2030. So it's a very ambitious plan, to say the least. And however, the EU has limited power over regional and legislation. So it's inevitably up to the member states to contribute towards reaching these targets. So how can the EU ensure that all these member states achieve the target, and what kind of standards should be set to be complete as possible?
Yes, so definitely we cannot force them. This is something that I already mentioned before. So European Union cannot force upon member states to or impose legal obligations to conduct this, because, as I've already mentioned, public health is primarily a national power, national competence, national prerogative. But what we can do on the European level is to provide incentives. So to provide organizational capacities, financial help, etc., and in this way to actually provide incentives for the member states to do it. Of course, then the problem is if we provide financial incentives, then the member states, this is something that can also be kind of problematic, because if member states get used to European Union financing a certain activity, then they will expect for this to continue also in the future. So this is something that we have to take into account. So I think it's not a good idea for the European Union to finance everything, because, as I said, European Union, the member states will just say, okay, will continue with this practice until you're financing it, but to try to find some kind of a balance between these different possibilities. So I think providing financial incentives is very important to do it in a kind of a project-oriented way. So not to just throw the money in the can, but really to stimulate those programs which are feasible, which are very well thought through, which are well organized. I think this is something, and also what is important is to actually have the financing based on actual effects and results. So if you perform well, if you are able to achieve the targets, then we can also provide additional incentives as well. So with Europe Beating Cancer Plan, this is a very important policy initiative on the European level in general. This was started by, I have to say, my political group, even before the COVID-19 crisis. Obviously, COVID-19 has now taken over the public debate, but I think it's important for us to maintain the beating cancer in general as one of the priorities of the European Union, because this is something new. So this is something that was never the case before. Europe was traditionally focused on finances, on austerity, on internal market, not so much on healthcare. So now we have the chance to put healthcare in the limelight and make sure that actually healthcare stays one of the priorities of the EU. And I think this beating cancer plan is good because this is the first plan which is systematic. So it's not just focused on treatment of cancer, but also on prevention, on early screening, and also aftercare for people who survived cancer. And I think the HPV here fits well into this concept. We have a very concrete target, which is very important. We were able to get the funding for it. So the funding for this program is 4 billion euros. So this is the basic funding for the entire plan. And this will be financed partly from the EU for Health program and partly from the cohesion policy and other sources of financing as well. So I just want to say that it is very important that we have this EU for Health program now, because we had it before, but this was much smaller, and this is part of the European Social Fund. So this is the first time that we have a self-standing EU for Health program, which is 12 times bigger than it was in the previous 7-year budgetary period. So instead of 450 million euros, now we have 5.1 billion euros allocated for this, and a lot of this will go into prevention. And I think in this will be one of the primary sources of funding also for this HPV vaccination campaigns. But cohesion policy is also important, especially in those countries where this public healthcare infrastructure, especially on primary level, is not well organized, where we don't, especially rural areas, where we like healthcare professionals to provide basic services. And I think that also in cohesion policy, which aims to reduce disparities, inequalities between different parts of the European Union, can also be used to a big extent to build this infrastructure, which is necessary if we want to have these massive vaccination campaigns. So I think that definitely that EU can play its part, especially by providing incentives, by providing funding and the projects and funding projects which will be part of this campaign. But it is important that this is also tied to results, tied to concrete to achievement of concrete targets. And I think that if we do this kind of dialogue between the European Union and member states, that this target is, even though it is ambitious, it's also achievable.
That's really wonderful to hear. Thank you very much. Andreas, so the vaccination schedule and strategies vary from country to country. So the large disparities present across EU countries, with very few countries actually meeting the widely accepted HPV vaccination targets. If member states fail to contribute towards reaching these targets of the European Union's Beating Cancer Plan, then it is simply just unattainable. So on a national government level, what can we actually do to improve and add resilience on the current programs to help prevent the spread of HPV? And how can other stakeholders actually contribute to this? So Andreas, love to hear your answer.
Yeah, thank you so much. I think this is a really important and valid point. And first of all, in this regard, I wanted to mention that we truly welcome and support the political momentum, setting forward the elimination of cervical cancer and also other cancers both in Europe and in the world. And I believe that together with the WHO's global elimination target and the European Cancer Organization's 4-step plan to eliminating HPV-related cancers, the European Europe's Beating Cancer plan is a very important milestone in the fight against cancer. And eliminating HPV-related cancers is a priority of this plan. And I believe that the ambitious targets regarding vaccination, screening, and treatment are essential to achieve the ultimate goal of elimination. Vaccination and reaching high coverage rates, as you mentioned, are an important step in the effort to eliminate HPV-related cancers in Europe. But in addition to the vaccination, screening, and treatment targets, communication will play an important role. And I think we are very fortunate to benefit from safe vaccines and treatment options. And as a partner in public health, we want to ensure broad access to HPV vaccines, obviously. And we also want to work together with authorities to raise awareness on HPV disease and also the benefits and the value of prevention, specifically in our communication with young people and parents to develop sustainable immunization strategies and programs also for future generations. And to increase and maintain VCRs, it is important, as mentioned by other speakers before, that the infrastructure supports the effort. This also includes new delivery systems like vaccination at home, walk or drive-in vaccination, and vaccination at pharmacies, as the other speakers also mentioned before. But it also includes extending the vaccination cohorts. This will also play a very vital role. So for example, as mentioned before, adding gender-neutral vaccination further increases the resilience of an immunization program, which means that the effectiveness can be maintained despite a temporary drop of the VCRs. And we are also very passionate about continuing our research and have more and more real-world data available that we can also communicate. So to give an example, a recent publication in the New England Journal of Medicine showed that in Sweden, cases of cervical cancer decreased by 88% in women or girls who were vaccinated before the age of 17. And as a father, the health of my children is a top priority for me. And these results underline the importance of vaccinating and protecting our children as early as possible before they even come in contact with HPV.
Oh, thank you very much, Andreas. So, Juan, in Europe, HPV vaccination data is not fully available and is undoubtedly causing issues in holding EU countries actually accountable for reaching their targets. So, Juan, what hindrances is it causing to the HPV campaign as a whole?
Yes, thank you. But data, I believe data is key in order to create and implement the right strategy, both at national and ultimately also at European level. And not having enough data is definitely a concern. And looking at Italy, because each region has its own little health system, let's say, it's very difficult to have a collective data at a national level. And an example of this, it's the fact that a few years ago, the in English would be the electronic health record was introduced, but when it comes to implementations, the usage rate is still really low. But this is not only among citizens; it's also among doctors and healthcare professionals, and so the rate of usage of this instrument, it's hindered by the regional barrier when it comes to exchanging the data. First of all, I know the Italian government is working in order to create the right infrastructure in order to make this possible, but I believe we need to also act fast, also to be able to share all this information also at European level and create the so-called EU Health Union as well. And also, there is a lack of information about these instruments, for example, but also misinformation when it comes to safety concern, when it comes to privacy and data. And this is something that citizens need to be assured about. And also another issue, it's the, let's say, the lack of digital competencies in a high share of doctors and healthcare professionals that hinders the users of these instruments, for example. And I think all these issues needs to be addressed in order to enable the sharing of information, like patients' health information, regardless on in which region he or she is, and also and this also impacts, of course, the HPV campaign, vaccination campaign. And because it's difficult to have reliable data and to track the vaccination coverage rate and the screening rate, it's also difficult to create tailored programs and in order to spot the right gaps and act on them. And in this way, if we improve also in these contexts, we will be able to have better results for sure.
Brilliant. Thank you, Juwan. So back in 2019, we actually built the Young Coalition for Prevention and Vaccination, also known as YC4PV, composed of young health professionals all across Europe. So the YC4PV is taking a proactive stance in advocating for prevention and vaccination. Many other young people are choosing to stand up and take the lead for a healthier future. But vaccination hesitancy is still heavily prevalent across the world. So before we give the floor to the audience for your lovely questions, I want to pose the following question to you, Carlota. How can young people like ourselves make a positive difference to ensure vaccinations become a social norm across the world?
Well, Ulfet, I really think that's our moment. The world today has the largest generation of young people in history, and many of them, as you have just said, are already driving a transformative change by raising the voice in the things they would like to see changed. And I believe that with the right support, the right tools, many others are poised to do so. In fact, this force for change represents an opportunity for institutions to somehow transform the way they engage towards sustainable health. We definitely should keep leveraging the energy and the creativity of young people, young health professionals to promote and protect the health for all, no? And keep engaging with initiatives such as the Young Coalition for Prevention and Vaccination that empowers the young people to support and promote the European, in that case, initiatives on vaccinations in both regional and national level. So I really think that we should make sure that everyone understands how great vaccines are and the why they need to roll up their sleeves by, of course, promoting the education on prevention and vaccine awareness. So, for instance, I think that we need, for example, to help educating the healthcare providers on the how to communicate with young parents in a way that would encourage HPV vaccination in that case. But also to support the promotion to accessible educational material on the value of vaccination by stimulating the interprofessional collaboration between the healthcare providers and the scientific community. And I think that to do that, we should leverage on this digital transformation that it's being accelerated by COVID and address the points just mentioned by G1.
No, thank you very much. And thank you to our speakers for the answers. So to our audience, please send in your questions and keep on sending them in. So we'll have our first question pop up. Thank you very much. So Shania, thank you, Shania, for your question. So there are campaigns like the European Testing Week, which encourages large institutions and small grassroots organizations to come together for a week to increase HPV, HEP testing every year, with access to funding and platforms to amplify the work of the organizations doing this week. So would it be possible for policymakers to support such an initiative for HPV testing and HPV vaccination in Europe worldwide? So Tomislav, I would like to pose this question to you.
Yes, sure. Why not? I think these kinds of initiatives are very good. I think it's important that we kind of try to connect, try to connect the policymakers with this kinds of grassroots approach. So I fully support it. But of course, we have to see about what concrete support is meant here, because there are obviously some procedures there, etc. If we speak about financial help, so this is something that needs to be organized in a way, but obviously when we speak of political support, policy support, or raising awareness, that's never an issue. Also, I think that European Union will in the future support also through projects which will be funded through the European budget, various projects like this, and there will be possibilities also to apply for these kind of financings through the national, obviously, to the national procedures. But so definitely, I think that there is a place for support from EU level. There is also place for support on national level. And as I said, I think policymakers should start to think about the long-term consequences, positive long-term consequences of projects like this. And I think that this can be beneficial for all of us. But I think what is also important here is that. We politicians, especially from traditional parties, kind of sometimes feel a bit distanced from the new generation. So I think that if we try to organize these kinds of campaigns in the sense of connecting the young people with the policymakers also find a kind of an additional advantage for them also to participate in these kinds of things. And I think it's also important then to also engage social networks to make it as popular as possible. So I think definitely that there is a place for such campaigns, but we have to see about what concrete support and all the details on how best to provide the support.
Thank you very much, Tomislav, and thank you, Shania, for your question. So we'll have the next one up. So we have a question here from Charles Howard. So we've seen some really interesting methods in ensuring people remain vaccinated during the pandemic. So example, pop-up and drive-through clinics. So are there any other innovative solutions you can think can be carried forward to help boost equitable access to HPV vaccinations? So I'll pose this question to you, Andreas, if you're happy to answer.
Yeah, thank you. Thank you very much. So as mentioned before, I fully agree that keeping vaccination coverage rates high is, of course, very important, and the access to the vaccines, and this also relates to the infrastructure. That's basically the foundation for that. It is extremely important, and I think as also the other speakers have mentioned before, we need to be looking at solutions where we can get as many people as possible vaccinated in a relatively short period of time. I think these are the things that we also have learned now from the COVID-19 pandemic, and I think we can now also apply these principles and these learnings to other vaccination campaigns like HPV, for example. So as mentioned before, it is theoretically possible to vaccinate at home, to vaccinate at pharmacies, as all of the other speakers have also already pointed out, and drive-through walk-in clinics. There are primary care vaccination centers, and I think probably we can think in the future of even more innovative or additional ways to get people vaccinated and to provide them with access to vaccines. And that's not limited to a specific vaccine, obviously. I think that's a general approach that we should take for vaccination.
Thank you very much for your input, and thank you, Charles, for the question. So we'll have the next one up. So we have a question here from Clementine. Do you have any examples of good practices, such as prevention or information campaigns targeting boys and young men? So how can we encourage them to get vaccinated? So Carlota, I would like to pose this question to you.
Sure. As far as I'm concerned, I haven't seen yet any campaign in which, well, in the UK, yes, they've been doing a good job, by the way, in promoting this equitable access for HPV vaccinations for boys and girls. So definitely this could be a good example that we can base ourselves. I was at the beginning thinking more in my more Spanish perspective, that I haven't seen really yet something like so targeted to boys and young men. But definitely, I think that one of the key things would be early education point and engage with them already from school base, because as other speakers have mentioned, the closed networks have a lot of impact. So addressing that from the very beginning would be key in that case.
Thank you very much, and thank you, Clementine, for your question. Please feel free to send in more questions as we go along, and then we'll go to our next one. So here we have a question from Evelyn. How can we break the stigma among young people? So what are some actions that we can take in schools? So Juan, I would love you to answer this question.
Yeah, sure. I believe Andreas really talked about this very well before, but of course, we need to understand there is a lot of stigma. This is a fact around this topic, and I think, as suggested by Evelyn, taking action in schools, like since primary education, would be key in order to from early age to give the children the right mentality and the right perspective on how to see this virus, and also have the right knowledge on how to prevent it, and give them the adequate information on the vaccination and the screening, and also letting them know that this is a gender-neutral vaccination and that doesn't concern any girls, and this in fact protects boys from the virus and the negative consequences of it, but also it enables us to control the circulation of the virus itself.
Thank you very much, Juan, and thank you, Evelyn, for the question. So I'll round up from there, and I'd like to say thank you very much to our speakers for joining us. But before we go, I would like to pose a question to you all, and I'd like to give you about a minute each to give your answers. So, would you like any key messages you would like to leave with our audience? I will start first with Carlota.
Yeah, sure. Well, I would like to end up by stressing the importance of avoiding vaccine-preventable diseases by creating new ways to deliver recommended vaccination and subsequently promoting healthy societies. So I would encourage all young people or young health professionals to become ambassadors for vaccination and awareness, but also influencers in the community to drive the behavior change that is required to increase the vaccination coverage and therefore protect the societies against diseases like the HPV.
Thank you very much. Tomislav?
Thank you. Around 40% of cases of cancer are preventable. So there is a big opportunity, there is a big possibility to use prevention as one of the main tools of reducing cancer-related deaths. And the cervical cancer, which is directly related to HPV, is the best example because it is almost completely preventable. So this is a very important issue. I think we can do a lot. It needs to be put much higher on the policy agenda of the policymaker, of decision makers on both European and national level. We have to invest resources into providing access to vaccination, both in terms of physical access and for this to be free of charge. We need to invest into raise awareness campaigns to reduce the stigma of the HPV and sexually transmitted diseases, and I think that we can really do a lot and have tangible results in the next 5 to 10 years. And I will definitely always support campaigns like this because I think it is very important to bring all the stakeholders together to hear, for us policymakers to hear what the problems are, but also what opportunities that exist. And I think that together we can do a lot to beat the cervical cancer. Thank you very much.
Thank you. Juan?
I couldn't agree more with what all the things that have been said. But to add on that, I would like to invite young people to engage and not only at regional, national, European level to make their voice heard, and that personally we are as organization and as a group of organizations, we are working to make Italy as a best practice when it comes to HPV vaccination, but we believe also that this can be extended to all the countries.
Thank you very much. And last but not least, Andreas.
Yeah, thank you so much, and thank you all for your very inspirational statements that you have just given. I really couldn't agree more with what you have just said. And I think that even though COVID-19 has now impacted immunization programs widely, we are definitely on the right track towards elimination of HPV-related cancers. Vaccination, screening, and treatment will obviously play a very vital role in achieving this ambitious goal. But our combined efforts, a very clear communication strategy, and strong leadership will be equally important for this. And I totally believe in the ability of young people to drive the needed and sustainable changes of behavior and mindset. And I really encourage you to do so and continue to do what you are doing. And I truly believe in a future without HPV-related cancers.
Thank you very much. And thank you very much to all of our speakers who joined us today. And thank you very much to our audience and for your questions as well. So a message out there to all young people as well. You have a big input on the future of prevention of vaccinations, as our speakers lovely did say. So please join us over the next few weeks. We have some great upcoming webinars. And we actually have one tomorrow at 11 p.m. CET, which will focus on ethical consumerism. So don't forget to check that out as well. So thank you very much to our speakers. Absolutely lovely to have you on board.